Hi, my name is Dr. David Evans. I'm an orthopedic surgeon with CommonSpirit Health, and my specialty is hip and knee replacement. Well, it was a long road to eventually getting into orthopedics, and for me, it was a lot of different interventions and things in school, and including science fair projects, and ultimately I settled on working on this bone graft that releases antibiotics, and I was doing a lot of work on that and interfacing with more and more orthopedic surgeons, and ultimately that led into an interest in the field, and from there it just took off and into applying clinical medicine as an orthopedic surgeon. Yeah, so I recently transitioned over to CommonSpirit, and it has been a wonderful transition and wonderful experience. They're very focused on the patient and having a good experience for the patient, but also the community. And from a physician standpoint, we are employed in such a model that we're only motivated in helping the patient and their medical needs. That for us, we see, equivalent reimbursement whether the patient is getting surgery or not. And I think that's a very unique model we don't see anywhere else today. And having worked in several health systems now, I can say it's very unique, and it's very refreshing as a provider to just treat what the patient needs with no outside influences. So I have a very conservative approach when it comes to patient care. I try to always exhaust conservative treatment before considering any surgical intervention. I like to understand a patient as a whole and take basically all their needs rather than just the problem at hand, and try to figure out the best solution for them. So I would say you can expect a visit where you can spend as much time as you need to convey your problems or your concerns. You can take as much time as you need to try and address the issue at hand and any other medical issues you have, to try and best assist you, and that we can come together with shared decision-making on the best approach for you and your concerns. Well, I grew up here in Salt Lake City. I grew up in Cottonwood Heights, Sandy area, and continued a lot of projects from my high school days in the nursing home and various community health centers, as well as several elementary and middle schools with science education. I've continued those projects today to still doing various health screenings and activities and education on arthritis and other community projects like that. Previous work that I'd done before, I've tried to continue today.